In what situations do patients typically need a dental crown?
There are different situations where patients will require a dental crown. If a tooth is severely broken down or has fractured in an entire cusp of the tooth, which is like one of the hills of the molars, these situations require a crown, and the crown kind of goes over the tooth. It looks like a tooth, and it is made of a strong material. And what it does is it imparts strength to the tooth so that it won't fracture in such a way that it can't be restored in the future. A tooth that is fractured previously is a good candidate for a crown if there's still enough sufficient tooth to crown. Also, a tooth with a very, very large filling will often be recommended for a crown so that it doesn't fracture in the future, because you get flexure around that filling over the years, and then eventually you get fracture of the tooth when you get a crack propagation from long-term cyclic loading over time. Teeth that have been root canaled are often in this category because they have been generally teeth that need root canals have been heavily restored. There's missing tooth structure that has been replaced with filling material. And now they've had a root canal. They've had to access that nerve through the center of the tooth as well. And all of these procedures cause the tooth to be weaker overall. And so a crown will go over, just like a bicycle helmet goes over your head and protects your head from cracking if you fall on it. A crown goes over a tooth and does the same type of thing. It braces it together so that it's not having flexure and there's no crack propagation and splitting of the tooth.
How long does a dental crown typically last compared to a filling?
The lifespan of a crown is likely to be longer than a filling, definitely. The purpose of a filling is to restore the form and function of that tooth. It doesn't impart strength. So whatever strength has been taken away by the decay eating at the tooth, that remains the same with a filling. When you have enough of that decay that's been removed and the filling becomes bigger and bigger, then obviously the tooth is weaker and weaker, if a filling is kind of railroaded through the tooth. So then that's when you would want to put a crown on to protect the tooth from fracturing. And yes, it does tend to be longer lasting than a restoration, especially if the restoration is in a tooth that then fractures and becomes unrestorable. Then you have to remove the tooth rather than have it safe underneath a crown.
What materials are used for crowns at Sublime Dentistry?
Yeah, we have used lots of different materials for crowns at Sublime. So zirconia is one of the materials that we use. We also use different porcelains and ceramics, depending on where in the mouth the crown is. We're looking for an aesthetic solution. Obviously, the closer we are to the front and even in the back, some people will opt for even traditional gold crowns if they're in a severe wear case and it's a back tooth. But that's not as common anymore. We are doing a lot of white colored crowns now. So generally zirconia, especially in the posterior and the back teeth because of the strength, and an Emax crown in the front. It has strength, but also beautiful aesthetics.
How do temporary crowns work, and what precautions should patients take?
So a temporary crown is a crown made of acrylic that we use temporarily while we're fabricating your crown. So we place it and it holds the space and it protects the tooth that we've just drilled for the crown preparation. It holds the space for the real crown, so it doesn't allow the adjacent teeth to move in or push in. Some of the precautions that patients should take while they're in a temporary crown are to avoid really sticky or really crunchy food on that side of their mouth. So I try to tell people to eat more to the other side, especially if it's very hard or sticky, or just avoid those foods in general while they're in their temporary crown. Also, I recommend that they brush their temporary crown, but in terms of flossing, that they floss and then if it's in the top, they floss up and then pull out through the side for that amount, for that time that they're in a temporary crown, rather than pulling back down and potentially dislodging their temporary crown. Once they have the real crown in, they don't have to worry about this. It's cemented and it's going to stay in place.
How long does a permanent crown last?
Oh, I've seen permanent crowns last well over 20 years. Yeah, it depends. Many crowns will last definitely, in the 10-year range. Depends on the rocks you chew and how well you take care of your teeth, because remember, a crown does end at the base of the tooth at the gum line, and if you don't brush or floss your teeth, you could get decay underneath your gum line or around your gum line that can travel up and under a crown. So people do still have to take care of these teeth. It's not that there's no tooth under there. There still is a tooth under there. The decay can't penetrate through the top of the crown, of course, because that's, porcelain or zirconia, but it can still get underneath in the root surface and come up. So in a healthy mouth, a crown can last, decades, but generally I would say definitely 10 years.
Can a crown be replaced?
A crown can be replaced, if there are problems, if there's a fracture, or if there was decay under the tooth, you can remove the crown and the crown can be replaced. It will depend on what the structure of the tooth that is left underneath looks like, because there has to be sufficient tooth structure to place the crown. So yes, they can be in many cases, but there are cases where, if a patient had let their tooth decay from underneath the crown, where there's insufficient tooth structure left to place the crown. But generally, yes, if down the road in years they want to change the color, if the rest of their teeth have changed color and they want to match the crown again, you can remove the crown and replace it with a new one.
Are there alternatives to a crown?
Not really. There's nothing that really replaces the crown. There are alternatives like just staying with a filling, but it's not going to provide the same benefit as a crown. So there's nothing that really replaces a crown in terms of what the crown does functionally for the tooth.
Can a crown be whitened?
No, a crown does not change color once it's placed. So porcelain, you can't bleach it or change it and whatnot. So once it's cemented in the mouth, that's the color that it's going to be. So it's important to make sure that the color matches the adjacent teeth, and that if the patient wants a whiter smile, that they bleach prior to having the crown done, so that we can then match the crown to the bleached teeth, and then they can keep bleaching their teeth every so often as needed, and they can keep that nice color that they desired.
What is the cost of a crown at Sublime Dentistry?
A crown ranges between $1,200 and $1,400, depending on various things like the complexity of the case, the lab fee that's involved, so the material that ends up being used. And with insurance policies, many do cover a good percentage of that. So that's important to consider as well.